we are trying to introduce some kind of presentation related to the agenda of integrated care. We are talking about the progress we are making in integrated care, integrated health and social care, and all the agenda of digital transformation related and supporting this agenda of integrated care. I think it's very important to go deeply. Sometimes when you are going to congresses, maybe you have very general presentations, but in this kind of training, I think it's possible to go deeply with some kind of elements, key elements, to overcome and to go forward with this kind of integrated care agenda.
I think what struck me about yesterday's event and what we've heard this morning is how similar our challenges are. I mean, I knew that before, but when you listen to them again, they are, we're all facing the same things. So for me, although I know a lot about Catalonia and what you've been working on, I did learn some new things. I learned an update about your digital health strategy and also your health plan. So yeah, I learned some new things today. It was good to see where you've come from. For me, the value of these twinnings, you can't even describe how valuable they are. They're inspirational. They help us back at home thinking about how we might do things differently. And they also give us some confidence sometimes that actually what we're doing is actually quite good. So I cannot recommend them highly enough. They're a really, really valuable learning opportunity.
So we are three and we are learning from each other, presenting now in Catalonian cases, rather after a couple of weeks in Helsinki, the Finnish cases, and finally in June, the Scottish cases. They are enlightened presenters chosen here, for example, the social work or social welfare issues brought up this morning, and also Jordi's excellent presentation regarding the digital transformation taking place here in Catalonia. I really share the same discussions for the near future